Alrighty, here we go. Hello everyone, and thank you for watching this program on cash plans and prepays. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information contained in this presentation is for educational purposes. It's not intended to be a substitute for your thorough clinical decision making. We don't provide legal advice. Target coding is not a law firm. CPT is a registered trademark of the AMA. Every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Just a little bit about myself before we get going. My name is Dr. Marty Kotler. I'm a chiropractor. Practiced for 16 years. About 12 years ago, I started a company called Target Coding. I'm also certified in CPT coding. I'm a certified professional compliance officer. We've helped thousands of doctors and staff members over the last 12 years with CPT coding and ICD-10 coding. Our areas of expertise include Medicare, billing coding and documentation, HIPAA compliance, chiropractic record keeping, how to create compliant treatment plans, how to create compliant cash plans. I've written many books and training manuals on billing, coding, and documentation. I write articles for Chiropractic Economics and Dynamic Chiropractic, the American Chiropractor, the American Academy of Professional Coders, Coders Edge magazine, and many other state association newsletters throughout the country. I'm also a guest speaker at many state association events nationwide. Those of you listening to this presentation, if you're part of your state association that's looking for a guest speaker on billing, coding, compliance, and record keeping, let us know. Maybe we could work something out. All right, let's begin with brand new patient comes in. We want to make sure we're getting paid for everything we do, right? That's the purpose of this presentation. It's to talk about cash plans, prepays, getting paid for what you do. So in order to ensure getting paid cash for everything you do, you need to have good forms. So when a brand new patient comes into the office, you want to get the forms out of the way, right? You need to take care of the forms. Now, some of you may do it electronically now. That's becoming more and more popular, where the patient fills out the information online prior to them even coming into your office. They log into your patient portal. You'd only be able to do that if you have certified EHR software, but that's becoming more and more popular. You could have patients go to your website and download the forms and fill them out and then bring them in already completed. That saves time. Some of you might have a patient, they walk into the office, you give them an iPad, a tablet computer, they're filling everything out, or you could do it the old-fashioned way, which is pretty popular. You hand the patient a clipboard with all the forms and a pen, and they fill it out. So get a good quality health history intake questionnaire. Definitely have a good financial policy. That's what we're going to be focusing on today, is financial policies, getting paid cash, how to transition cash insurance patients to cash patients. This is all about cash today. We're not going to be talking about insurance. A lot of people associate, my company and me with, oh, he's the insurance guy. Not true. We are the getting paid properly for what you do, guys. We are about coding, compliance, documentation, and making sure you're doing things right. So when it comes to cash, many people do things incorrectly when it comes to collecting cash, discounting fees, having dual fee schedules. So there is compliance, yes, when it comes to insurance codes, but there's definitely compliance when it comes to getting paid cash by patients. And I can tell you the number one reason for state board complaints by patients against chiropractors is the patient does not feel that they were charged properly. So you want to have good policies and procedures on how you charge patients. And then we have assignment of benefits. Let me stop there. Assignment of benefits. If you are a cash practice where you don't want the checks coming to you, now that's rare, but I have probably about 30% of the doctors that I work with are all cash. I have more cash practices becoming clients of Target Coding lately than ever before, because they just want to make sure they're doing things right. That's what I hear all the time. Doctors calling me from all over the country. One of the first things they say is, Dr. Kotler, I just want to make sure I'm doing everything right. Give doctors a lot of credit. So if you are a cash practice, meaning that a true cash practice, which means patients are coming in and paying you cash. You're out of network with all plans. You don't want the insurance checks coming to you. So if that's the case, do not have the patient sign any assignment of benefits forms. That contradicts what you're trying to do. And then we have authorization to release information, letters of protection, informed consent, consent to treat minor, acknowledgement form for non-payable services. That's how you get more cash coming into the practice. I have a sample form. I'll show you what that looks like a little bit later. You have Medicare forms, outcome measurement forms, the HIPAA Notice form, and then there are some state-specific forms. So have nice professional-looking forms. Remember, when a patient comes into your office, if you have paper forms, make sure they look nice. Get colorful ones. It's the patient's first impression of your practice. A lot of good forms out there. Make them look nice and professional. I've been to many. I've probably been to about 300 offices over the last 12 years doing on-site trainings. Every once in a while, I'll go into a doctor's office where the office looks beautiful, but the doctor's forms are gray, they're old, they're outdated. I recently went to one doctor. He bought a practice from another doctor. He's still, the doctor, this young doctor that just bought the practice is still using the forms from the previous doctor that's been there 25 years, So have nice forms. This is a HIPAA notice form, very important. Every new patient is required to review your HIPAA notice. There's a lot of good information here. There's one part of this form. Now, this form protects the patient and the doctor. So it's not only about, the patient here. You want to protect yourself using this form. You could modify these forms to add certain things. I'm going to give you examples a little bit later. But there's a portion of this Notice of Privacy Practices, which is right from the federal government. This isn't a form that I created. Many of you have HIPAA notices. I don't know where you've gotten them from. I was reviewing one of my clients' HIPAA notice, and it had all this dental information in it. His brother-in-law is a dentist. He never read it. The patients weren't reading it. Nobody's reading it, and he's giving out incorrect information. Read your forms. Anyway, this form, it says if a patient wants to pay for the service in cash, out of pocket, in full, at the time of service, the patient could say, I don't want you to bill my insurance. So patients have rights. Any of these forms that you see me showing here, if you'd like them, just send an email to amy@targetcoding.com, AMY@targetcoding.com, and we'll get you these forms. And the patient has to sign that they have acknowledged the form. They acknowledge it. They have the opportunity to get a copy. So get all the forms out of the way. All right, now let's talk about money and fees. How much should you charge for your services? Before we even get into taking cash from patients and prepays and time of service and hardships and all of those fun things, how much should you charge? Very common question. I talk to a lot of chiropractic students. My nephew's a student right now in chiropractic college. He's in his second year. I'm always speaking to students, and one of the main questions they ask me is, Dr. Kotler, when I graduate, how much should I charge? Well, your fees are typically determined by three things: work and skills utilized by the provider, your overhead and administrative costs, and your malpractice expense. That's the formal definition of how to determine a fee. Let's forget about the formality there. Ask other chiropractors in your town what they charge. You want to be somewhat competitive. Unless you're doing something that's very unique and different, you want to be competitive. If all the other chiropractors in your town are charging $40 a visit and you want to charge $140, you're probably going to have less patients coming in. Again, unless you're doing something unique and different, which makes you stand out from the rest. So shop around. Be a secret shopper. I did an on-site training with a client of mine in St. Louis, Missouri, and he was charging $45 for cervical films. I said, Doc, this is very low. He didn't think it was that low. He thought that was a fair fee. So we decided, I was a secret shopper. I called the local hospital And I said, hey, I'm thinking about coming in for x-rays. I don't have insurance. How much do you charge? They said $235. My client almost fell off his chair. He's just way undercharging. Shop around. Review your fees. Now, you want to get some formal guidance? You can buy the RBRVS Physician's Guide, and you can take the relative value units times that by the conversion factor for your area. You should review your fees annually. If you're billing insurance, take a look and see what insurance is paying for those services you're providing. Now, here's another resource that you could use. This is the fairhealthconsumer.org website. There's the link. Go ahead and enter that website into your computer. Go to your zip code and put in a code that you typically charge and see what comes up. This assists consumers as to what is a fair fee based on a particular CPT code. And every time a client of mine says, Marty, I think I'm overcharging. I don't know. I'm a little concerned I'm charging too much. Or I'm concerned I'm not charging enough. Well, go to this website and put it in. Every time a client of mine thinks they're overcharging and they go to this website, and this website shows that the fee is more than what they are charging, it makes you feel better. Go ahead. Take a look. This is what patients can do. They can go in your zip code, put in a code like 98940, which is a chiropractic adjustment, 1 to 2 regions, and see what comes up. If you're charging 40 and it comes up 40 or more, you're in pretty good shape. Excellent website. I recommend you all go to it and check it out. Here's another question that I get asked by students. So, Dr. Kotler, I want to open up a cash practice. I just want to charge one fee. I want to charge $50 for every man, woman, and child that comes into my office. I want to charge $50 for a chiropractic adjustment. Just want to do that. Is that possible? Can I do that? Well, probably not, but maybe. Let's dig into this a little bit. First of all, you need to be profitable. There are some chiropractors that I graduated with. Some of them are friends of mine and terrific students. 4.0 GPAs, smartest kids in the class, have shut down their practices, couldn't make it. You need to be profitable. I know some chiropractors, excellent chiropractors. I go to one right now. Gives me the best adjustments. Struggling. Now, that's rare. Most of the doctors that I work with are doing very well, but some are struggling. So this doctor, excellent chiropractor, can't make it in practice. So in order to make it in practice, you need to be profitable. You need to make money. You can't give away your services for free and expect to make money. You can't give away your services and try and make it up in volume. You need to be profitable. And your patients understand that. Your patients realize in order for you to stay in business, you need to be profitable. So do a little calculation. What's your overhead? Let's say it's $10,000 and you see 100 patients a week. That means it costs you $25 to give somebody a chiropractic adjustment. Now, what's your cash fee? Is it above that, below that? Do this exercise. It'll be very enlightening. It could even be a wake-up call. I was with a doctor recently. His number came out to $35. High overhead, not that busy. His average cost to deliver was $35. I asked the doctor, how much do you charge your cash patients? He said $30. I said, whoa, time out. It's costing you $35. And you're taking 30? He said, the next time a patient like that comes in, just hand the patient $5 and tell him to go home. It's the same thing. I'm somewhat kidding. So, understand, you need to be profitable. Do this exercise. What is the number? You have to charge at least what it costs you. If you were selling, let's say, umbrellas, and it cost you $10 and you're selling them for $20, and somebody comes in and you start selling them for $5, you can't make that up in volume. You have to be profitable. You deserve to be profitable. You deserve to get paid for everything you're doing. Run this little exercise. Okay, so back to the is it possible? Again, can I just charge 50 bucks across the board? Well, you have that could be considered your normal standard fee, $50, but now you decide, you know what, I'm going to go in network with some plans like Optum, Ash, Blue Cross Blue Shield. Well, they may say, that's nice, Dr. Kotler, that you charge, a 50, but we only pay 40. So you're going to have to write off $10. Now you decide, you know what, I'm going to enroll in the Medicare program. You're going to see Medicare patients, and you're going to charge $50 for an adjustment. And Medicare says, whoa, we allow $30, so you have to write off 20 bucks. And then you might treat some work comp patients. Well, there's a fee schedule associated with that. Then there's personal injury, where you might want to charge more than 50. And then there's your regular cash fee. So is it possible to have one fee? I guess it's possible, but it's not probable in today's healthcare environment. Now, being part of some or all of these different categories does not mean you have a dual fee schedule. Just to clarify, a dual fee schedule means you're billing insurance. Example, you're billing your PI patients $230 a visit, and now a cash patient comes in and you're doing the same exact thing and you're charging that patient $60. Way too much of a discount. But if your normal fee is 50 and you're in network with a plan that only pays 40, hey, there's a different fee. That doesn't mean you have a dual fee schedule. You want to keep fees simple. Fee confusion, I mentioned this already, is one of the most common reasons for complaints to state boards. I've had to help many doctors over the years with state board complaints directly related to fees. All patients should be aware of your normal fees. Some providers give discounts. They don't tell the patient that they're discounting the fee. The patient thinks that's the normal fee. Then the patient comes in with insurance, and now you're billing a larger fee. You didn't tell the patient what your normal fee is, and now the patient's upset. Educating patients about fees and medical necessity is more important than ever before. If you have a patient call an insurance company to say, hey, I'm calling to find out if my plan covers chiropractic, you know what they'll hear? Assuming it covers, and most do. Most plans cover chiropractic. So this is what they'll say. Yes, we cover chiropractic as long as it's medically necessary. Okay, so medically necessary means insurance payable. Maintenance care is not payable. Active treatment, according to Medicare, is payable. Active treatment means the patient has pain, restricted motion, decreased ADLs. Very little pain, great range of motion. Patient could do most of their ADLs. That's not payable. If it's not medically necessary, it's not payable. Performance enhancing care. I had a lot of golfers coming in, although I don't really play golf. I dabble in it. I was attracting a lot of golfers into my practice, and they would love getting adjusted because they would say they could hit the ball further. I would have patients coming and say, hey, I tee off, I hit the ball 200 yards. I want to hit the ball 220 yards. You're helping some of my friends with your lower back adjustments. Can you help me with that? Can you help me hit the ball further? Sure, come on in. Let me adjust you. That's not payable by insurance. Now, when I looked out into the waiting room, there's a little humor here. When I looked out into the waiting room, let's see, there were 6 patients waiting to see me. My viewpoint was I saw a patient. Some patients, I didn't even know their names at first, but I knew their conditions. I'd look out into the waiting room. Oh, yeah, there's Mary. She gets headaches. There's Bill. He has rotator cuff syndrome. There's Beth. She has sciatica. Next patient, neck pain, knee bursitis. Oh, yeah, there's Andrea. She's got a herniated disc. That's how I oftentimes, would associate patients with their condition. That's okay if you're the doctor. If you're the billing staff person, if you are the insurance manager or you're the office manager regarding getting paid, when you look out into the waiting room, this is what I want you to see. Oh, there's Beth. She owes me 20 bucks. Oh, I got to get an updated credit card from Carla. She, gave me a credit card. It expired. Oh, yeah, there's Joe. I got to get an updated ABN form signed. So the doctor sees conditions, staff members, you need to see money. So when it comes to medical necessity, sometimes, well, oftentimes it depends who you ask. If you ask Aetna, Aetna says the patient has to have a neuromusculoskeletal condition. It has to be clearly documented, and improvement has to be documented within the first 2 weeks of care. So I'm not going to get into too much insurance. I just want you to see one example of what's considered medically necessary versus wellness care, maintenance care. So here are I've broken it down into 10 categories as far as getting cash from patients. The first category is patients come in and they just want to pay as they go. They're going to pay your full cash fee, pay as you go, no discounts. Next category, you're going to offer a discount. I call it a prompt pay discount. Your normal fee is, let's say, $100, but because they're paying you cash, you're going to give them a little bit of a break. And then we have prepays, hardship. What do you do when you're in network as far as collecting cash, out of network cash, Medicare and cash, PI and work comp and cash, discount medical plan organizations like Cairo Health USA and cash? And then you have health savings accounts and health retirement accounts. So let's go through each one. Cash patient just says, I want to pay as I go. Okay, so I've put together a sample. This is my sample 30-visit financial care plan for cash patients. You may use a 12-visit care plan. Some of you may use a 60-visit care plan, a 6-visit, 72 visits, whatever you want to do. That's up to you. I've chosen a 30-visit care plan for this educational presentation. So patient exam, 75, x-rays, 125. The adjustments are 40 each at $30 each. I'm sorry, 30 visits at $40 each. Traction, $20. And a couple of re-exams. Re-exams are 50. So the total fee here is $2,100. Patient pays in full on each visit. They need a walkout receipt, that's fine. And by the way, I'm going to be sharing a lot of fees here with you. Don't use these fees. This is just for educational purposes. So there's the first category. Next category is time of service fees, prompt pay. There's many different terms for the same thing. You're giving the patient a break. You're giving them a discount. Time of service fee. I like to call it prompt pay. I used to call it an administrative discount fee, but that's a little too complicated. So you want to give the patient a break. And what's the purpose? The purpose of the prompt pay is to reduce debt collection. It should be about 10 to 15%. Where am I getting that number from? I'll show you in a minute. This is not based on the patient's condition. You cannot advertise the discount. And it's only offered during your financial report of findings. So your normal fee, let's say, is $40. You want to give 10, 15% off. So that means 40 minus 10, 15%. Let's say it comes down to 34. So the patient is saving $6 per visit. They pay you 34. Your normal fee is 40. You write off the 6. You can give the patient a walkout receipt if they would like. So here's the document that I use. There's, many doctors, that I talk to go, well, I offer a free exam here, and okay, I charge PI $200 a visit. My cash patient comes in, I do the same thing, and I charge, only $100. Well, that's a 50% discount. That's way more than what the federal government says. The federal government says, 15%. So if any of you listening to this presentation have any literature, I'm open for suggestions. I love to learn. I'm a sponge. I continue to learn. I go to seminars all the time to learn how to teach my clients how to be compliant, how to prevent fraud and abuse. So if any of you listening to this presentation have information that you'd like to share with me, I'd love to see it that allows you to give a 50% discount, a 70% discount off your normal fee. I would love to see it. I'd like to share it with my clients. Please, if you have anything, in writing from a reliable resource, not your friend who went to a seminar in Australia. I want to see black and white reference data. This is the only one that I can come up with. This is right from the federal government, so I use it as my guide. You may have a state-specific. There are some states where they allow free exams. They allow, to give, 80% discounts. Great. I'm just looking for something I can share as a general federal guideline, because I have clients in about 35 states across the country. So if you have one, hey, listen, if you have one from a particular state that says you could offer a 70, 80, 90% discount, I would like to see it too. So anything regarding discounts, please let me know what you got, but this is the one that I use as my reference. Here's another document also from the federal government. The Office of Inspector General, the OIG, says you could give away a little bit of a gift to a patient. You can give a $15 gift to a patient per item, or $75 gift in aggregate per patient on an annual basis. So that's why when I see there's a chiropractor I know not far from me, that I see these huge full-page ads: exam, x-rays, consultation, normal value $230, come on in, no charge. I don't get it. I don't know how that's legal if the max is 15 per incident. All right, let's go over prepays. So prepays are fantastic. I love prepays. Prepays get patients pay for multiple visits in advance. That's great. There's less congestion at the front desk, less administrative work. Patients that prepay, they very rarely miss their appointments. They are your biggest cheerleaders. Prepays are terrific. Offering prepays, well, there's some negatives. If you're offering a prepay to an in-network patient or an insurance patient, you could have problems. The in-network agreement probably prohibits you from collecting copays in advance. Now, you may be able to collect copays in advance, but you cannot offer a discount on them. And oftentimes, if you're getting a certain amount of prepay, you have to put it in a separate escrow account. Some states allow up to $1,500. So here's another thing. Find out from your state association, your state board, what is the maximum allowable amount of money you can collect from a patient on a prepay. There's one state in there's a state here in that I work with a lot of doctors, where the cap is $1,500. I have some clients, they're collecting $3,000, $4,000, $5,000, $6,000 from the patients in a prepay. They didn't know. They had no idea. A couple of them have gotten in trouble for it. So that's what we do. We protect you. We give you the laws, the rules, the guidelines. You know what I say all the time? You got to know the rules in order to know if you're breaking them or following them. Next, hardship. Yes, there are some patients that just cannot afford your care. I say give them a break. You're allowed to give patients a break. If the patient has a hardship, I have a hardship form. You know what? There are some patients I treated for free. Whoa, what, Dr. Kotler? That's a violation. Wait a second. There are certain cases. I had a patient come in, single mom, no job. I said, I'm going to treat you for free. But when your financial situation changes, you're going to have to pay. And it happened. She was no charge for about 9 months, and she finally got a job. And we started charging her again. So we have a financial hardship form. Now, what is the financial hardship based on? I'm a little bit, I approach mine a little bit different. If you want to learn more about how I approach hardships, then email Amy at targetcoding.com with your questions, and she's excellent with that. Or you could email me directly at drkotler at targetcoding.com. So there are these formal applications and ways to prove that the patient has a financial hardship. So this is, again, documents right from the federal government. I like to use reliable resources. The federal government is, it's a resource. So here's, how to create a discounted sliding fee schedule. So if anybody wants these, let us know. Next, manage care. Okay, so you're in network with a plan. How do you maximize cash? It's tricky. It's hard to. If you're delivering a medically necessary service, can't discount that. You can't have the patient pay you cash. So you're required to bill for all your services. You're going to collect the copay, the coinsurance, the deductibles in full. You're going to bill your normal fees. You must accept the contracted fee. Don't collect the copays or deductibles up front. Okay, now you have a little bit more freedom with your out-of-network. How do you maximize cash out of network? Well, you could bill your normal full fee. The patient could pay you your normal full fee if you wanted to. You could accept assignment or not accept assignment. You don't want to collect the copays, deductibles up front. At maximum therapeutic benefit, you're going to transition the patient to wellness or discharge the patient. Now, if you're going to provide a service in or out of network that's not covered in the plan, I would recommend you have them sign this acknowledgement form. It lets the patient know that this service is not covered by your insurance. Sign this form that you acknowledge it. I've just summarized a very lengthy form, but that's basically what this form says. Now you have a Medicare patient come in. How do you maximize cash with Medicare? The easiest way, in my opinion, is Medicare. Medicare only pays for spinal manipulation. What else do you do, doctor? What else does your staff do? What else do you do, staff members? Do you do exams? Cash, full fee from your Medicare patients. How about x-rays? A lot of you take x-rays, full fee from your from your Medicare patients. So Medicare is all cash, except for spinal manipulation. So why does it cause so much stress and so much confusion? When I do seminars and webinars, when Medicare's the topic, it's my biggest turnout. Even though there are more and more doctors that are working with me that are cash and they don't even take Medicare, Medicare is still very popular amongst chiropractic practices. There are 29,000 chiropractors that that are enrolled in the Medicare program. Let me ask you a couple of questions. Can you treat Medicare patients without being enrolled in the Medicare program? The answer is no. If you don't have an active number, if you are not enrolled in the Medicare program, you should not be touching Medicare patients. Wait a second, Dr. Kotler. If I just do an exam and I do non-spinal manipulation, you're saying I cannot take a Medicare patient? Yes, I'm telling you, you should not touch a Medicare patient. For anything, exam, x-rays, modalities, adjustments, you should not touch Medicare patients if you're not actively enrolled in the Medicare program. Next, can you collect cash from Medicare patients without billing Medicare? The answer is yes. Get them to wellness and sign option 2 on the ABN. Have you revalidated your Medicare organizational profile? You need to revalidate. Do it when they ask. Can chiropractors opt out of Medicare? The answer is no, absolutely not. Opting out is a private contract. Chiropractors are not on the list of providers that can opt out of Medicare. Can chiropractors opt out of HIPAA? Maybe. We can get into that a little bit later if we have time. So when it comes to opting out, when I bring it up, a lot of doctors get confused. What do you mean, Dr. Kotler? I'm not in Medicare. I'm not opting out. I just take cash. Okay, time out. Let's pump the brakes a little bit on this one because I have a feeling a lot of you are confused. That's why I went and got this document. Where? From Medicare, directly from Medicare, so you don't have to believe me. So it says right here in the bottom right corner, doctors of chiropractic may not opt out of Medicare, noting that opting out and being non-par are not the same things. Chiropractors may decide to be par or non-par with regard to Medicare, but they may not opt out. Next, make sure you're collecting coinsurance. Don't waive the copays. Don't waive coinsurance. Don't waive deductibles. Waiving copays and deductibles is a violation. There's no way around it. Now, if you want to work out payment plans, you want to stretch the payments out, there's different ways, which if you're interested in learning more about that, then, contact us. Send an email to amy@targetcoding.com. Say, hey, Amy, I'd like to set up a free 15-minute phone consult with Dr. Kotler. Go ahead. Do it. We'll set you up. Don't mess around with these things. Here, this is a letter that a doctor got. It says, the purpose of this letter, doctor, is to inform you that our office received a complaint alleging that you knowingly process Medicare claims as if the patient is paying their copays, but the patients are not. Wow, that's a scary letter to get. So this is the whole letter that the doctor got. Got actually lucky. Didn't have to pay any fines. Next, PI and work comp. Well, work comp and PI in most states, work comp in most states, you cannot collect any money from the patient. PI in some states allow you to accept payment from the patient if you'd like. However, if you don't accept assignment on a PI patient, they're probably not going to come in. This is where the dual fee schedules, when it comes to PI, this is where it gets crazy. So you cannot charge PI $250 a visit, do the same thing, and charge a cash patient $40. With work comp and PI, you'll send your notes in with the claims. You may have to get certain services pre-certified. Check with the work comp and PI rules in your state regarding collecting cash prior to seating patients. Next, DMPOs, Discount Medical Plan Organizations. I love Chiro Health USA. There's a few other DMPOs out there, but the one that I like the best is Chiro Health USA. It alleviates this dual fee schedule. If you want to charge your PI patients $250, you want to charge State Farm, Geico, Allstate $250 a visit, and now a cash patient comes in and you want to charge them $30 for the same thing, the only way that you can do it, in my opinion, is through an organization like Chiro Health USA. Provider joins the network, you set the fee. You set the fee. When you join Medicare, they set the fee. When you go in network with Optum and Ash, they set the fee. When you go in network with Chiro Health USA, you set the fee. It allows you to substantially discount your fees legally. It prevents dual fee schedules. It could work with Medicare patients, high deductibles. The goal here, in my opinion, is Chiro Health USA first, and then set up an auto debit account. And then we have health savings accounts, healthcare reimbursement accounts, flexible spending accounts. These are cash. I love these plans. Patient comes in, give them a walkout receipt. Here's a sample of a simple walkout receipt. No CPT codes, no diagnosis codes. If you can get away with that with your health savings account patients, that would be ideal. Now you need some diagnosis codes and CPT codes. Okay, again, you can keep it simple, or you could print it out on a 1500 form, just using here just the simple subluxation codes and a chiropractic adjustment. Now, if the health savings account patients are coming in for wellness, use the S8990 code for wellness maintenance. Next, have good financial policies. Good financial policies gets patients to understand your office billing and coding collections procedures. A financial policy allows patients to understand that collecting money from insurance companies may not be that easy if you're accepting assignment. It helps educate the patient about acute care, chronic care, wellness care. Patients need to understand they are responsible to pay. It prevents upsets. Having policies and procedures prevents problems. If you have a nice formal financial policy, have the patient sign it. You keep the original, give a copy to the patient. Here's our sample financial policy. Thank you for choosing ABC Chiropractic Center. Based on your history, exam, and diagnosis, we're going to recommend a financial care plan. What is it based on? history, exam, diagnosis. Very important. Your financial policy should not be based on what the patient can pay. If they're driving a Mercedes or a Honda, it has nothing to do with that. Financial, it's not based on, well, you have good PI insurance, Mrs. Jones, or Mr. Smith, your insurance pays 60 visits, so let me put together a financial plan for you. No, your financial plan should be based on the history, exam, and diagnosis. The clinical findings, that segues into how much does the patient need to pay. So we have a very nice financial policy, explains everything to the patient, lists everything. You could modify it. We have an acknowledgement that the patient understands this is not a guarantee. They agree to it. For the non-covered services, you're saying, we don't bill for non-covered services. Now, unless it's Medicare and the patient checks option 1 on the ABN form for spinal manipulation, I don't know of any other company that requires you to bill for non-covered services. So have good forms, have a billing and coding policy manual. Why? You may be asking, why, Dr. Kotler, should I have a billing and coding policy and procedure manual? Well, I could tell you, number one, there's 3 reasons. For your staff. Your staff members want organization. They want leadership. They want to work in an ethical and trustworthy environment. A billing and coding policy manual creates a culture of compliance. It's an extension of your mission and values. Also, if you have a staff member that's accusing you of wrongdoing, a policy manual, that's your ammunition to defend you of any alleged misconduct. For insurance companies, state boards, malpractice, a billing and coding policy and procedure manual can prevent audits. And if you're audited, it could mitigate fines and penalties. You look really bad and unprofessional if you can't prove to an investigator, a state board, or even a patient what your billing and coding policies are. They must be formal. That means in writing and kept track of in training logs. And finally, for the doctor, a billing and coding policy manual is a custom-made document for your particular type of practice. Let me give you an example. You may adjust full spine, but you're only billing 98940. Do you have a policy on that? If you don't, you could be accused of incorrect coding. And a billing and coding compliance manual, it allows you to tell your story your way in a professional manner. It'll definitely help you SWAN. It's one of my favorite acronyms, SWAN, which means sleep well at night. So a billing and coding policy, you should let everyone know, staff, insurance companies, state boards, that you have your own internal way of reviewing patient files and financial records. You do it on a regular basis, and you review charts. This is a little chart audit tool that I put together. You can go down this little checklist. If you see Medicare patients, you have to go to the OIG exclusion list. It's mandatory to see if you've been excluded from the Medicare program. Here, this is just a whole bunch of different things. For example, we utilize an open adjusting room. We make good faith attempts to keep our conversations at a low level. We offer every patient the opportunity to be treated in a private room. If a patient ever says, oh, I'm always in this open area and everybody's talking and I don't like it. Oh, wait a second, Mrs. Jones. You were offered the opportunity to be treated in a private room. And I have some policies on. With every patient encounter, we analyze the entire spine. We only bill for medically necessary services. The other services that we provide that we don't bill for, that could be a compensatory subluxation from the primary diagnosis. For example, patient comes in with neck pain. I work with a lot of doctors that use activator. You may adjust an ankle, a knee, a shoulder. It has nothing to do, as far as the insurance companies may go, state board, malpractice. Wait a second. The patient's only complaint is neck pain. Why are you adjusting their ankles or their lower back? You should have a policy on that. How about when it comes to time-based codes? I'm working with one doctor right now her associate just got up and quit one day and said, I am reporting you to all the insurance companies because you are not billing time-based codes properly. My client freaked out. She was so upset. So she didn't have a policy on how to bill for time-based codes. If you have a policy on it and your staff members read it and they sign off on the policy, they could accuse you whatever they want, I guess, but you're covered. So there's a whole bunch of items that you should have, how to deal with compliance concerns if there's breaches. Hey, one of my clients said, Marty, every time I go into the office, my staff is always on their cell phones. I don't know what they're doing, but it's driving me crazy. So I helped him create a cell phone access and usage policy and procedure manual, policy to be put in the manual. And here's another policy on the ABN form. All right, so just a few closing comments. Please check with all the carriers you bill prior to submitting claims to ensure that's compliant. We can't guarantee that this information will guarantee payment from any insurance company or patient. The rules and laws change all the time, so stay on top of these changes, attend seminars, webinars, join your national and state professional associations. Here's our contact information, info@targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044. You want to fax us some stuff? Use our HIPAA secure fax number, especially if you're going to be faxing us patient-protected health information. Our HIPAA secure fax number is 844-831-2347. Oh, I've updated my guidebook. Those of you that have bought my book, this is my #1 best-selling book that we have here at Target Coding. It's the book on the best CPT and ICD-10 codes. There was a little bit of an update, very small update recently, so it's all included with the book. And this book has a page or a section on about 25 of the most common diagnosis codes and how to do ortho, neuro, chiro tests to support it. For example, if you're going to diagnose a patient with cervical brachial syndrome, do Wright's, do Atson's, check for myotomal weakness, forward head posture. Nice little guide. I have a section here on FAQs. Many doctors have no idea what the difference is between a disc disorder and a disc displacement. Many doctors have no idea what's the difference between radiculitis, radiculopathy, and myelopathy, and that's okay. I work with, I have some clients, they're in practice 35, 40 years, and they don't know what the difference is between a disc disorder and disc displacement. Not a big deal. I've gathered a lot of these FAQs over the years, and I put them in the book. The book also has a list of the diagnosis codes that pay for the most visits. That's pretty valuable. There's also some cheat sheets. Oh, we also offer HIPAA. We have a HIPAA compliance program. Now with HIPAA, I have two questions for you. Are you a covered entity? HIPAA applies only to covered entities. As a chiropractor, are you a covered entity? Question number 1. Do you bill or receive payment from insurance companies? If you answer yes, you are a covered entity. Let's say you go, no, Dr. Kotler, I'm a cash practice. I don't bill insurance. I don't receive any money from insurance companies. Patients come in, they pay me cash, I give them a walkout receipt. Okay, so you may not have to abide by HIPAA. Question number 2, do you submit claims electronically? If yes, you are definitely a covered entity. If you say no, I don't bill insurance, I don't get money from insurance, I don't submit claims electronically, so you may not have to abide by HIPAA. I get this question, Dr. Kotler, I'm an all-cash practice. Do I have to abide by HIPAA? Or everything's in the cloud, Dr. Kotler. I don't have any patient information on my system. Or, you know what, Dr. Kotler, I don't have any employees. Do I have to abide by HIPAA? I have one client, she doesn't even have a computer. Does she have to abide by HIPAA? Maybe not. Send an email to amy@targetcoding.com. We'll set you up for a little time to go over this. And we offer a HIPAA compliance program, very comprehensive. If you're thinking about, well, you shouldn't be thinking about. You should be making attempts to put a HIPAA program in place. It's a federal law. You don't want to be violating the law. Again, back to the doctors that I speak to all the time that say, Dr. Kotler, I just want to make sure I'm doing everything right. Okay, well, federal law says you have to have a HIPAA program. Oh, I didn't know I had to do that. Now do you still want to do everything right, or you want to do mostly everything right? That's what I should probably hear from doctors. Hey, Dr. Kotler, I want to be compliant. I want to do most things right. Doesn't make sense to me to say that. So we have a HIPAA program. Shop around while you're looking to get a HIPAA program. Compare ours. Make sure you're comparing apples to apples. Ours is the most expensive, but you get the most. So you're not getting a Honda, although I love Hondas. When you sign up for our HIPAA program, you're getting a Mercedes. There's a difference. If you have a friend that works for a Mercedes dealership and one works for a Honda, like to see that conversation. Oh, we offer acupuncture billing, coding, and compliance. So here's again, why should you have a billing and coding policy manual? We went through that. So we offer a billing and coding policy and procedure manual. We offer a Medicare policy and procedure manual. So these are good things to have. We also do seminars. We have, 2018, we just are planning our 2018 seminar schedule. I already have 11 events booked for 2018. We're going to be all over the place. We have tons of seminars and webinars coming up. So much exciting, good stuff here at Target Coding. We're expanding. We're growing. We have a basic membership, just pay as you go, $99 a month, pay as you go, no contract. Then we have a gold membership. Platinum membership, which means I come to your office and do a full day of training. For most offices, I will come and do the training. I have some staff members that might come. So if you really want me to come, then we'll make it happen. But I don't do all of them. So we have a platinum membership. All right, so I want to thank everybody for attending. I hope you learned a lot. Let's go and take a look and see what questions have come in.